Welcome to My Pet Project. This is Lauren Brinkman. Today I was able to chat with Dr. Lindsey Alman, who is our lead for our Street Dog Coalition, Madison. Once a month we get together and serve our community by opening up our warehouse at Underdog and setting it up as a makeshift vet clinic where we provide free veterinary care for people experiencing or at risk of homelessness and their pets. We are able to provide free wellness exams or sick exams and get vaccines in those pets and get them the medication that they might need. We like to give them preventatives, and Street Dog Coalition provides all of those supplies that we need, but we absolutely could not do it without a doctor, a veterinarian who is compassionate, meets people where they're at, and helps get their pets as healthy as we can with what we have in front of us, which is not always all of the diagnostics and all of the things that would necessarily be ideal if money wasn't an issue. But I would say with the majority of people, money is an issue. And so to be able to help these folks who want to do the right thing by their animals, but might not have the resources to do so, is really gratifying. And I'm excited to talk with Lindsey today and learn about the work she does and why she does it. So people are living in their car to keep their pet and their family. And they're going above and beyond, but because they could be in a shelter, they could be crashing on a friend's couch. But a lot of times these pets aren't welcome in different homes or different rental facilities. So it just, I think the people are doing this for their pets, but also the pets are offering so much to their lives. So the work that you're doing through Street Dog, I can plan things, but I can't provide veterinary care. And so you're giving such a gift to these individuals to keep their families together.
Yeah. It takes a village. It's, I need the technicians and
the awesome reception volunteers.
And people have just worn many different hats.
Mm-hmm.
They learn. And I've been really impressed, honestly. Yes, I do. You need a licensed veterinarian,
Mm-hmm.
and it would be great to get some other vets on board just to even, there might be times where I can't do it, and even if we had a situation where we could have, 2 veterinarians or have an extra day here and there, and even just maybe more than one place. There's so many different possibilities. We've already started so much just through Underdog. Having the extra resources, to be able to have the supplies and all of that.
Or evening hours or weekend hours. It would just be huge to have an extra set of hands, because there have been times that we needed to cut it off because we can only see one doctor seeing 20 patients with, there's a lot of ailments that you see. It's a big undertaking. So, so how... were you one of those little kids who always knew you wanted to be a vet? Tell us about how it went from where'd you grow up and how did you discover your love for animals?
Yeah. I don't know if it's the millennial thing or what, but yeah, it's very super classic. I was 7. At least that's what my parents say, by the age of 7, she knew she wanted to be a vet. And I knew very early I loved animals. I had a fascination with horses too, which I wasn't introduced to horseback riding or husbandry, any of that until I was 10. But I grew up with, we always had a dog. We had rabbits and guinea pigs and fish, all sorts of critters. And I was always there, going to the vet visits and just I was fascinated with that side of it. And also just taking care of animals. I would say definitely my dad would say that, my pets were his pets, which I understand now with my own children. So, he still had to support me quite a bit as a child to be able to do a lot of those things. However, I was pretty young. I want to say I was around 14 when I had a new horse. It was my second horse. The first one, it was a he was a little too wild for me when I was like 12 and 13 years old. And this horse became very sick. And it was like Christmas Eve, super classic, like, of course, it's a holiday and it was freezing cold. And so one of the treatments that he needed for his sickness was these humongous injections of penicillin.
Oh, wow.
Like these like huge syringes. And I'm pretty sure I was 14. So my parents would have to drive me out to give these shots twice a day for, I don't know, a week or something like that. And, so the vet just showed me how to do it and I was all for it. And my dad's like, I don't do needles. So, so that was kind of my first experience with like more of the medical stuff. And that definitely drove my curiosity. And I was like, oh yeah, this is my thing. And even with like my rabbits, kind of maybe a little bit before and a little after that incident had happened, there were times where I had to like give, medications by mouth, and I had like the syringes and I had, the schedule and all of that. So it was just like throughout my childhood and like when I was a teenager and those stages, I just had a fascination, but it was definitely even more so towards the veterinary side of it, like the medical side of it.
Wow, for that to be so natural to you is crazy, because there's plenty of 14-year-olds I know who it's hard to even have them get a vaccine when they go to the doctor.
Which I was that child.
You were still like to be able to play vet.
Yes, yes. And I started volunteering when I was 15. Like just, volunteering in the sense of like watching surgeries and, being at the vet clinic and like basically cleaning, but just seeing it. And so, that was it. That was my track, which it has definitely been a wild roller coaster ride. And I have had questioned it many times. It was not a direct path, let's put it that way. But in the end, it was the right path. The way that I got there is what it was supposed to be in.
I think there's such a gift in having that purpose and knowing what you want to do. Because I know so many people in their 50s and 60s who are like, I still don't know what I want to be when I grow up.
Yeah.
And to have that, not that your path might, change a little bit here and there. You've worked in different areas of veterinary medicine, but that's pretty neat to have that in your heart, like from such a young age.
Yeah, absolutely.
So you grew up in California, Northern
California. Yep.
And you went to, did you go to UC Davis
for
your undergrad?
For undergrad.
Okay.
Yes. Yeah. So I was like, prior to having any sort of travel, I didn't go very many places. Ironically, Madison, because my extended family was here. So this has always been a special place for me. But aside from that, it was all the vets I knew, and just being Northern California, it was like everybody goes to UC Davis and that's what you do. And I did, animal science there, and I was pre-vet and worked as a technician at the equine ICU isolation unit, because I'd previously done like small animal ER technician work, like worked my way up. And then I was kind of more on that equine track, but I didn't have as much of the medical stuff other than having a horse. And that was sort of my mindset. But then I did start to think about mixed practice, like doing not necessarily mixed, but like large animal, not just horses, but maybe cattle. So I don't know. In my head, there was a lot of things going through it. But the biggest change that happened throughout the several years I was in undergrad, I did study abroad in London, and that was, just kind of very general education, like, English, and we were going to museums and, nothing related to science, basically. But that exposed me to just a completely different world, different country. And just, I learned how much I loved to travel. And I had traveled a little bit before that, right out of high school. So within a couple years, my just my love for travel and getting to see different cultures and everything was definitely there.
So your world got so much bigger just because you had that experience.
Exactly. And so there was this idea of London, maybe because I had the Royal College there. So that was in there. And when I was at Davis, there was definitely like this internal like struggle of, and with Davis, it's notoriously difficult. So it's most people, it's like, okay, you're going to have to apply several times. You got to be in it. And I wasn't really in it. And I definitely was more interested in having a different type of experience. And some of it too was, do I do Peace Corps? I wanted to have an element of not just going to veterinary school and becoming a veterinarian, but also I just wanted to do more. And it was when I was at UC Davis working as a technician that I met it was more of like a volunteer position, but one of my classmates was there and she actually had just gotten into veterinary school and she mentioned a school in Scotland. And at the time she didn't say which one. And I had, been thinking about London, like that was in the plan to apply there. And so that sort of started this whole path of, I started looking into it and the different programs. And yeah, long story short, I ended up at University of Glasgow in Scotland. And the program, what attracted me to it, not only is it, you get to go abroad. Obviously, they speak English. That's,
that's a benefit. You don't have to learn a whole new thing.
Yeah, that's where it came from. But yeah, so it was definitely, just an opportunity to have that, I don't know, worldly experience and not just be there, but also travel from there. And, so I guess the biggest thing for me too was the hands-on aspect, because I'm very much like, I need to see it, do it, and like, kind of that visual. And they really have you jump in and literally do all the things.
And that's not how vet school always is. Like in the US, no. I just had the impression that people are essentially like doing a lot of book learning as a base, which I'm sure it's not like you didn't do that. But like what do you mean by hands-on? Like, so you go out, are you staying in a dorm, or where do you live when you go? Like, did you have an apartment?
I was in the like older students, because I was in my 20s at that point. So I was in like an older student dorm situation. It was very interesting.
Wow,
like I kind of went backwards a little bit, but also, I don't know. It was fine. I did eventually live in a flat, like an apartment basically. But when so we had these, we called them externships, or like, I don't know exactly the equivalent here, but essentially the first couple of years, it was preclinical. So it's like literally went out to, so one of the experiences I had was in Wales, and I just went there for, I think it was 14 days or so, and just lived there on a farm with sheep. It was like lambing season.
Oh, wow.
And it was just me and a farmer. And
so like you didn't even have students with you. You just went and you got this personal experience working. So it had to be really hands-on, because it wasn't like a bunch of people fighting for the experience. Lambing is like you were helping them give birth to babies.
And acres.
Wow.
Yeah, pretty much. Yeah. Just out there, I'd be walking around through like the rolling hills in the middle of the night, like listening and,
And I'm ignorant to this. Like, so with them giving birth, like, is that all happening seasonally? So it's not just one, like, happening whenever. It's like there's a bunch and you're there to experience
and
that.
Definitely things go wrong. And so there's a lot of like, you do need to, keep an eye. And there were definitely some sad cases where they didn't survive and things like that. But it was, it's husbandry. That's really what it is. It's like figuring out, getting the groundwork, rather than just doing the books and going straight in, you're the doctor. It's like, and that's kind of where I have all like just put it all together where I've come now. That has allowed me to be who I am and keep me grounded, I guess, to see those different perspectives, working with farmers. And then from there, traveling even more abroad, to developing countries and, places where, it's more a village and they are surviving on whatever animals they have, whether it's a herd of goats or, it's a very very different experience.
Like, where did you go outside of, like, did you stay all in Scotland, or did you get to go around, like, for your work experience, for your school experiences?
I went to a bunch of places. So Wales was one of the first. And then I ended up doing this really random, it was like you could just choose a couple weeks of I think we had like a 12-week block where you had to do all these different things. And it was like, you get to pick what you want to do. And I did something called Camels in France. And it's a behavior course in the south of France. And it was it was a Brit that somehow some crazy story. That's a whole other conversation. But basically, she brought camels over from, Middle East, basically. And they were rescued. They were rescue camels, I guess, because she did some sort of tourist something or another and was working abroad herself. And somehow she got into that.
Got into camels.
And her behavior. So what she ended up doing is having a program about clicker training and just behavior in general. So like, her experiences with people kind of led into this path of behavior in animals and kind of the link there, which definitely when you look at like human animal bond, that's kind of the core of it too. But a lot of this was like learning about these different animals that were on the farm, which for me, my very specific thing was it was a little piglet, like a literal wild piglet. It was like their pig. I don't know what kind of pig. I can't remember. But it was like semi-domesticated. But then her and like a wild boar made some babies. And so I had to go catch a wild piglet. It was like this little teacup thing at the time and train it. So I had a few days to train it and clicker training and like that positive reinforcement and, like literally click, if people watch various, I don't know, like the dog training shows.
Yeah,
and
like
things
Karen
like
Pryor,
that.
like there's like a bunch of clicker training programs that we kind of, but I really only thought about it with dogs, and it seemed really progressive to think about doing it with cats. And apparently that's not even the tip of the iceberg.
Yeah, yeah. No, I trained this little piglet I clicker trained it. Like it would come and like put its little nose on like a ball and do like a little dance and various things. I mean, pigs are very smart.
Do you have
they're very
video of
messy.
this?
Somewhere.
If you find it, I would love to see that.
Yeah, it was a long time ago, but yes, I'm sure I did. I definitely have some pictures. Yeah, and then kind of the end of the course, because I was working with goats, and I mean goats are also they do like almost like agility
Really?
training with them. Yeah. But I did get introduced to at least one camel, and I was able to use some of my skills because she wanted you to be confident at that point because these are large creatures.
Yeah.
And they had been through some terrible things. So that was, it was very random, but it's also super important because not only is it, behavior as a veterinarian is so important, but you also do get like the human side of it. Just that connection.
I just don't, like, my impression is that there's certain things that vets don't, it's not a given that you're going to get it in school. And I'm so not a medical professional, but just after talking to a number of vets, it's like you don't get a ton of training on behavior, and especially positive based training, like clicker training. That's awesome. And then or nutrition, like things like that, behavior, a lot of vets in the US, I don't think get hands-on. And maybe if you would have picked a different activity or a different externship there, you might not have gotten that. But what a cool thing for you to have experienced.
Yeah. And I actually, just to take off with that, but when I was at UC Davis, part of my animal science interest was behavior. And I took a few courses with Sophia Yen, Dr. Sophia Yen.
Oh my gosh.
And she wrote me one of my letters of recommendation. Yeah. That for me, working with her, she was so brilliant. She definitely told me like, you're going to need to work really hard. Like I said, I'm very hands-on at, looking years later at what happened to her, losing someone in the veterinary field or just anyone by suicide. For people that don't know, she was a renowned behaviorist veterinarian. Everybody had her book, and that was huge. And it really highlighted the mental health issues that people face that we're completely unaware of sometimes.
Yeah, there's the Not One More Vet
Mhm.
campaign. I mean, I feel like vets get the brunt of it. I mean, their clients love their animals, and I think because of that, their emotions sometimes stand in the way of them being kind to vets. And I would imagine this happens to some level in human medicine too. But just the guilt that vets feel when they lose a pet. When an animal passes away, you can only do so much, and
Mhm.
sometimes the environment that vets are working in, where people are just so angry with them, even though it's beyond their
Yeah. Just being
control.
human.
And just the stress. I mean, you're not guaranteed hundreds of thousands of dollars as a veterinarian. I would say almost nobody's getting that kind of money. And no, I mean, the stress of student debt. I mean, I'm sure there's just like a million different things that we could
Mhm.
rattle off that are stressors, but
That's kind
gosh.
of where, I mean, doing things like this, it completely keeps me grounded. And I feel like all of us, we've needed help,
Mhm.
at some point in our lives or currently in our lives. I mean, we all need it, and I can help. I mean, this is something I can do. And not that I can't do other things, but like this is my thing. And as long as I can do it, as long as I'm physically able to do this, I hope to continue it. And hopefully we can get others to join,
Yeah.
and start this movement, because it's just becoming, just all of it is just becoming a bigger issue. But I kind of went different direction there, but important.
Yeah, yeah.
So
Well, and I think, yeah, just having the community we have, and even during moments that we've had a little bit of, of a stressor in the street dog work we've done with the trauma bonding that we've kind of done through some difficult situations. Not to dwell on that, but I mean, it's like I've been amazed by your resilience and your ability to just see the big picture of, hey, we've got people to help here, and we can't let one person, ruin the work that we're doing.
Yep.
For all these wonderful people that need us.
Yeah.
And I mean, I guess it's interesting because we're talking about the people so much, and we get into this industry
I know.
for the animals. And so many people are like, I work in veterinary medicine, or I work in sheltering or animal welfare because I don't like people. I want to be here. I'm here for the animals.
Yeah.
But gosh, do we realize we need those people to advocate,
I know.
to care?
I know. I had recently, when I was working in Milwaukee, and it was New Year's Eve, and there was an elderly lady that I want to say she lived maybe like a mile or at least a half a mile away, and it was cold and super windy, and she had a walker, and she actually her cat was having trouble peeing, which is always a big thing.
Mhm.
And she actually just kind of put him on this like shelf, and was kind of, I don't know, tied him in somehow, and walked
Ooh.
in this crazy weather and this freezing cold on New Year's Eve.
And she got there with the cat?
Yes.
Whew.
Yes. And, and I ended up driving her home. And she was just like, I mean, she was very thankful, but she was so, I don't know, she took the help, but she, clearly she wanted to do all these things, and she was going to do whatever she needed to do for her cat. But it was just like the sweetest thing. I mean, it really, and also just seeing how thankful she was for the help afterwards. But that's what we see here. People will do so many, sometimes very dangerous for themselves, things for their pets, so that, they can keep them alive. And, because those animals are helping them through all the things. And I know a lot of us in vet med have had pets that, you have these markers in your life of like, they got me through this and they got me through that.
Oh,
and,
yeah.
And I'm sure it's not true, but, I've had clients say, I love my dog more than my kids. It's just so different. And they're 100% reliant on you too. But they do, because of the connections that you have when you are working with these animals, unless you're in some very specific area of vet med or in the industry that you truly don't work with clients, which I don't know what that is.
Yeah, it's far and few between.
I mean, you're going to hear so many different stories, and you kind of feel like a therapist sometimes. It can be really, really hard, but it's also, I love it in the sense of people feel comfortable that they can share these things. And hearing stories, especially like end of life, there's always the stories that people want to tell about their pet and what not, there's just so many different markers for when that pet was alive, what was happening in their life. And there's so much more to it. It's not just kittens, puppies. It's, super complex. And hopefully someday there'll be more resources for people. I know we've talked about that, just would be nice, obviously having nonprofits and having supports there so people can have lower cost care for their pets. And I know there's probably some, situations where people can have pets in their, for special needs and various things like that.
Yeah.
But financially, I feel like there's not a whole lot, these pets have to stay healthy, and that takes care, and it costs money. And
it's not even, I think people right now with how all the problems that we're experiencing in 2026 and before, and we probably will continue to after. As people, like older people are on fixed incomes if they're in retirement, and people have spent their whole lives taking care of kids or, younger siblings or pets. And then they get to the point where they might be going to assisted living and they're still on that fixed budget. Assisted living costs more than even an apartment or a house. And then they can't afford a pet. And then I think they kind of lose themselves sometimes. I think there's such a huge value. I was actually just talking to a veterinarian who works at UW, and she's doing a research project on how to remove barriers so that older people can have senior pets. And
awesome.
I love senior animals so much, and
yes.
that's really cool to think about finding more homes and supporting those relationships, because I think our lives are richer when there's animals in them.
Yep.
How do you stay sane through all of this? You're a mom to 2 young kids. You are a wife to an educator.
Yep.
And you work crazy hours doing urgent care. You have some pretty big dreams that I would love to quick touch on before we're done. But how do you keep it all together in addition to this volunteer work? I know, that's a lot.
Yeah. The volunteering for sure is a huge part of it. But for me, I've always said it's my therapy is running.
What was that wild run that you did recently? You did something
the
outlandish.
Kettle Moraine 100 mile.
Oh my gosh.
Yep. So that was probably a one and done.
Oh my gosh.
I qualified for Western States. We barely qualified, put in my ticket, and did not get in, but that's okay. So yeah, I don't have anything planned, but aside from just getting outside. Even when it's freezing cold, it has at least been sunny.
You're still out running in this? Wow. That seems insane, but I sort of get what you mean. There have been days that I was really stressed and I got on the treadmill for even 10 minutes and it makes a difference. And I probably did a half mile. But you're running miles and miles, and that's awesome to figure out the magic for your brain and body to be able to keep on keeping.
Yeah, it's just, for me, it's just getting outside. I'm not running fast or anything, it's getting out in nature. And I prefer trails lately. I've just been wherever I can, and I usually run with a friend, and it's a whole thing. It's just time away. So yeah, it's literally therapy for me.
Something I've always admired about you is that you know where your passion lies and what's important in your life, but you're not afraid to make big changes. You've actually something I meant to ask you that I didn't even write down was you've talked about career coaches or I don't know if that's the right word, but I think it takes a lot, because a lot of us walk around thinking we know everything. I think it's really neat when, well, I mean, for me, I've found that therapy has been huge, even though like I had this bad connotation with it from growing up, just feeling like it was kind of a punishment. And now I'm getting so much out of it. And I feel like reaching out to others for help who might, have guidance for us. Like, so tell me about this coaching that you've done, if you're comfortable talking about that. Like, because is it career coaching or what kind of person?
Yeah. I mean, originally I was introduced to the concept of coaching, at least for my profession, when I was in California. And it was more I was still kind of a new vet going into like kind of an environment where I was the only woman vet. And there was just a lot of learning curves too. And it was, for me, the reason for the coaching was to understand how to work with my, with working with the technicians, basically working with the other employees. And then, from there, learning how to interact with clients, not that I wasn't good at it. It was more just improving those skill sets. Some of it is being a woman and the things that go along with that. So, that was a little bit more of a forced situation because it really needed to happen. But also I felt a little more isolated in that instance. What I've more recently done since moving here, and I've been here about 3.5 years, I sort of, through like a mom group and mom vet group, found a veterinarian who coaches as kind of, one of the many things that she does. Very much like me, like she's mom and owns a business and like thousand things. But is learning, once again, how to communicate with people. I mean, communication is number one. If you can't communicate, you really can't do anything else. And it's so learning more about yourself and how you communicate and trying to understand about other people. And, and obviously from there, it's almost like another place of therapy, but it's very much about your job. And I mean, the thing that I guess is different, and I don't know, maybe it's kind of 50-50 with people, but I definitely know plenty of people where their job is a job. And then you've got the other half where it just can't ever be just a job. Just like my husband being a teacher, it's never going to just be a job. These are kids and it is their life, and sometimes, I mean, if you're a really good teacher, you may change that person's life. I know I have, the favorite teacher that I had in high school, and, in some ways, yeah, he made a huge, mark for me. Like anyways. So for me, this is not ever going to be just a job.
Yeah.
And so trying to figure out how can I fit in this world of veterinary medicine. And that was a huge part of it. Yes, I need to learn how to work with different people. I mean, yes, we're similar in some ways, like how we gravitate towards vet med, but also we're very different. And, you've got the different generations and just how quickly vet med has changed too.
Yeah.
And just learning how to, work with different clients. From there, really coming to the realization that I want and need to own my own practice. And the hope is that it's going to be an environment that's, really supportive to the staff. That's number one, is like, you have to support your staff to be able to support anyone else.
Support
like
community,
always
clients.
Put the on the plane, right? Put your mask on first. Yes. So that piece of it, but also the community. And I feel like that's where this connection has been so important to me because, yes, there's a street dog side, but then there's also the underdog side. There's so much going on here. And, I just, and I've done a lot, but I still have so much more to give. And I want to find this community so that, we can all work together. And that's, it took, I don't know, it was probably like 2.5 years of coaching, pretty, routine. I mean, I had a lot of it. At one point, it was like I was in it because I was really focused on what I wanted. And of course, it's changed here and there. but, it's helped me realize the why. And and now I have a path moving forward.
Yeah.
I'm still going to keep doing all these other little things that I'm doing, but that's, in the end, I will own my own practice, and I'm hoping it's not going to be nonprofit, but hopefully it can still be community centered, and not just for the people in the community clients, but also for helping support other, busy vets and ERs and things like that. So
being collaborative.
Mhm.
Yeah, I think with what you're saying, like the culture of a workplace, it doesn't matter if it's veterinary or anything else. It's like whether it's toxic or whether it's supportive, or usually it's somewhere in between. I feel like that makes a huge difference in retaining employees. And just, I mean, when I go into a place as just a customer, I can tell if people are having fun. And, like I go into one brand of movie theater and the people look like they're like, oh, I'm just watching. Here's your popcorn. And then I go into like flicks and people are having a blast working there. Like, it's just like you get that vibe. And I think that it has to do with the leadership, and I think that I've seen you, the way you talk with clients from Street Dog, and how you talk to people who I know have nice homes here in Madison, to say the least. Like you meet people where they are and you help them understand clearly what needs to be done for their pet. And gosh, you're always trying to figure out a plan on how, whether we can achieve the gold star standard of care or whether we're MacGyvering something together to help them do the best they can with what they have and what resources we have to give. I think that that's a really cool skill to have. And I think that you had the compassion to begin with, but I think the communication and coaching and just the urge to be always learning is a pretty good indicator of the things you're going to be able to do.
Yeah. I mean, I think luckily here we have, honestly, amazing resources from Street Dog Coalition. Obviously, it's not, we don't have a lab, and there's certain things that we can't do, but we have a lot of supplies, which is fantastic. But I think coming from, going abroad and seeing some of the things, and even just, you don't have to be abroad to be like a large animal, James Harriet type, where you're just out there in the middle of nowhere in California. And, you have limited things for whatever farm animal you're going to go see. So just learning how to kind of just figure things out on the go. And that's a lot of what we do here, and that's what a lot of people have to do in a lot of different situations. It's not always easy for people to do that. But I think being flexible and like open-minded to that too. Yeah. There are so many different types of people, and it doesn't matter. I mean, I've worked in all different types of environments and clinics. Everybody's a human being, and they all deserve respect. We also deserve respect too.
Absolutely.
So of course we're always going to be protective over our volunteers and our staff and whatever setting we're in. And it's just unfortunate, but we do what we can if we have a tough situation. But we're going to continue to help people and their animals, because I mean, yes, we, of course, in the end, we love these animals. We want them to be safe and healthy and, free of disease and all of the above. But I mean, these people, for some of them, it took a lot for them to get here. And that's where I always feel bad when it's like if we have like 40 people waiting and there's absolutely no way we're going to get to them. And we had the pyometra that got fit in, and, you guys were able to take care of it at Underdog. And there's just crazy things that can happen sometimes. And even if it's like more of a wellness type clinic. And so, if we had more people and more, or more clinics available, and just more help in the community, that would be like, it's great what we have. It would be awesome to just
amplify
spread more awareness.
And we actually do have a vet clinic. I don't know if I told you, we have a vet clinic that is taking a whole volunteer day to come and work with us in April, I think.
Yes.
So hopefully that will make people see how cool the work you're doing here is. I'm so grateful for everything that you do. And it's really neat learning about like how you, your origin story going through Scotland. I mean, I don't know. I feel like you've had so many interesting experiences, and I wish we could sit here and I want to hear all your stories. that will be
Maybe I'll write
another
a book.
time. You should.
I don't know what it would look like. It would be very random.
Oh, yeah. But I mean, well, you've told me stories. I don't know. We could sit here and talk for hours because you worked in the fires in California. I mean, you did all these things. You basically the stories I remember, you put on a backpack, went up and just started helping people randomly. You set up a table with some people who were also trying to help outside a shelter, and you just started helping these animals. You were you are an amazing person.
I need to be active. I need to do things. And, it's nice when it's in a situation where you have support.
Yeah.
So, that was more of a crazy time. And, there were things in place and, but there were some situations where I did just kind of show up and it was a little bit of a cluster, but it's made me a better person, all of these different things that I've been through. And
even probably a stronger doctor. I think every experience that you've had. And so now your next foray is in urgent care, which I think is really exciting. I think that that's such a big need in our community for everyone, even people with a ton of money. If you are having an urgent situation with your pet, sometimes you can't even get into the UW clinic. These places that are great resources, there's not enough. So.
Yeah, I mean, it's helping clients, people with pets, but it's also helping, the vets that they're having clients call at 5 p.m. and they're, they can't see all of them, and the weekend's coming up, and then you've got the ER, like you said, I had to take my own dog in, and those animals, they're very, very sick, and they only have so much staff and so much time to give all that attention to them. That's why there's urgent care for people. I mean, I go to urgent care for people more than anything else, because there's things that your regular doctor doesn't need to see you for, or your kids for that ear infection. But these are things that are very uncomfortable, and sometimes they're very scary, but they're maybe not sit in an ER for however many hours to potentially get turned away or spend over $10,000. It's and sometimes that's needed, or even just being that place of trying to figure out the triage aspect of it. We just need more of that. And, I hopefully can help in some way. There's a lot of different places for people to take their pets here, but it's, there's a lot of people and a lot of pets and only so many places. So that's where, hopefully we can all work together. And
I think our community, if any community can do it, I think it's Madison. So I'm thinking that it's going to be another great point of support for other clinics and people and
absolutely
pets.
Yep.
Well, Dr. Lindsey Alman, I am so grateful for all the work you do. I'm really proud to call you a friend. Thank you for being here and for the work you do to make our community a better place.
Thanks, Lauren.